Okay, let's be real. Hearing the word cancer, it's a lot. It can feel incredibly overwhelming. But the very first and most powerful step you can take is to just understand what you're facing. This guide is here to walk you through the essentials of colorectal cancer simply and clearly. So let's get started. First things first, it's so important to know you're not alone in this. Colorectal cancer is actually the third most common cancer diagnosed in both men and women, not just in the United States, but all over the world. But here is the most important message, and I want you to hear this right from the start. This is a disease we can often prevent, and when we can't, it is highly, highly treatable, especially when it's caught early. There is so much reason for hope. To get there, though, we've got to break it down. So, what are the key things you really need to understand about this diagnosis? Let's walk through them together. We're going to cover 5 main areas. First, we'll start with the absolute basics. What is this stuff? Then we'll look at the 2 main ways it can develop. After that, we'll trace the journey from a tiny growth to cancer, and you'll see why that makes screening so incredibly important. And finally, we'll touch on what navigating treatment looks like. All right, let's dive right in with a simple, no-jargon foundation. What exactly is colorectal cancer? At its core, it's a cancer that starts in the large intestine, that's your colon and your rectum. The best way to think about it is this. All of your body cells have an instruction manual, your genes. Well, cancer happens when that manual gets errors or mutations that build up over time. Those errors tell the cells to just grow and divide out of control. So a huge question people always have is, why did this happen? Did I get it from my family? Let's look at the 2 main paths that can lead to colorectal cancer. Now, this chart is really revealing. You see that huge slice of the pie? About 80% of cases are what's called sporadic. That just means the cancer wasn't directly passed down through a known genetic risk in the family. The other 20% or so, that's what we consider inherited, or having a strong family link. So, to put it really simply, sporadic cancer just kind of happens from random genetic mistakes that add up in your colon cells over your lifetime. Inherited cancer, on the other hand, means you were actually born with a specific genetic risk that makes developing it more likely. Both are important to know about, but sporadic is by far the most common way this happens. Okay, so let's get into how this cancer actually develops. And this is a really key point. It's not something that happens overnight. In fact, it's usually a pretty slow journey. And this is a concept you really want to grasp. Almost all colorectal cancers start out as a totally benign or non-cancerous little growth on the inside lining of the colon or rectum. And that little growth has a name. It's called a polyp. This slide shows the progression perfectly. See? You start with a healthy colon. Then, because of some of those genetic changes we talked about, a small polyp forms. Then, over time, it can get bigger. And with even more genetic mistakes, it can eventually turn into a cancer, or what doctors call a carcinoma. And right here, this is the single most important aha moment in this whole story. This entire process, from a tiny polyp to a full-blown cancer, usually takes several years. And that slow progression, that's not a bad thing. It's our greatest strength. It gives us this incredible window of opportunity to find and remove those polyps, literally stopping cancer before it even gets a chance to start. And that idea, that window of opportunity, brings us directly to one of the most powerful tools we have in our arsenal, screening. You see, the goal of screening isn't just to find cancer early, even though that's great too. The #1 mission is prevention. It's all about finding and removing those precancerous polyps during that window of time so they can never, ever become a threat. And speaking of screening, there's been a really important change recently. Because we're seeing more cases in younger adults, the American Cancer Society now recommends that people who are at average risk should start screening at age 45. That's a shift from the old recommendation of 50. Now, besides screening, it's worth knowing that while we can't control our genes, big studies show that certain lifestyle choices do play a part. A diet heavy in red and processed meats or high alcohol intake might increase risk. But on the flip side, things like eating more whole grains and dairy and getting regular physical activity, well, those have been shown to help lower it. So what happens if cancer is found? Let's talk about the path forward. It's really important to know that today we have a very clear, very structured approach to treatment. The first thing to understand is that treatment is not a one-size-fits-all deal. Not at all.
Your medical team will create a plan that is personalized just for you, and it's based on things like the cancer stage, which just means how far it's spread, and its own specific genetic makeup.
And this slide shows the main tools in the treatment toolkit. Surgery is really the cornerstone, often the first step to physically remove the tumor. For more advanced disease, there's chemotherapy, which uses powerful medicines to fight cancer cells all over the body. Then we have these newer, smarter drugs like targeted therapy. They're like guided missiles that attack specific weaknesses in the cancer cells. And then there's immunotherapy, which is amazing. It basically revs up your own immune system to go do the fighting.
Ultimately, everything we've talked about today is really about empowerment. It's like the slide says, knowledge is the first step. Understanding what you're dealing with, your screening options, and the treatment path ahead, that is your single greatest tool on this journey. So the big takeaway here is this. Take this information and use it to start a good conversation with your doctor. They're the ones who can help you put together a personal plan that's exactly right for your health, your history, and your life.
And that leaves us with one final thought. Whether it's scheduling that screening you've been putting off, writing down a question for your next doctor's visit, or maybe just sharing this with someone you care about, how will you take that next step in your own health journey today?